Patients presenting for breast augmentation are always very concerned about a potential scar that may or may not be noticed. There are 4 incisions that you will hear about if you're doing some research about breast augmentation. There is a transaxillary, which means through the armpit incision. You also hear of a belly button approach. And then there's an inframammary crease approach, which means a scar under the fold of the breast. And the last one is a periareolar approach, which means a scar around the outer border of the areola. The most common approaches that we use for breast augmentation are the inframammary, meaning under the breast fold, or the areolar border approach. And the reason that those are the most common are because it gives the surgeon direct vision in dissecting a breast pocket. It has the least amount of risk and the least amount of complication. Scars are inconspicuous after breast augmentation. When you're looking online or in the office at before and after photos, you almost never visualize a scar. So it is important for a surgeon to have direct control over a breast pocket and be able to do the surgery with as much technical ease as possible. So you'll see most surgeons advising a direct approach, which means on the breast, again, under the inframammary crease or within it, or around the areolar border. Which incision I choose for a patient depends not only on patient preference, but also on their anatomy. So when you come in for your consultation, based on how you look and also your goals, we will pick an incision that suits you. Also, with the newer cohesive silicone breast implants, or in layman's terms, you hear the term gummy bear implant. These implants are firmer and typically will require a slightly larger incision. Usually an inframammary crease incision is the best option to insert some of these larger, more cohesive implants. Patients also are going to be back for reoperation, as implants are not lifetime devices. So whenever a patient presents to have their implant removed and replaced, it's very difficult to go through a remote site such as an armpit or a belly button, and most women do end up with a small breast scar at some point, regardless of the initial approach. I'm Dr. Hayley Brown at Desert Hills Plastic Surgery Center. We offer free consultations for all patients considering plastic or cosmetic surgery. Call the office at 702-260-7707 or visit us at our website at www.deserthillsplasticsurgery.com.